All right, let's dive right in. Today, we're going to unpack a really complex and honestly a pretty misunderstood disease, systemic lupus erythematosus. You've probably just heard it called lupus. And yeah, it's famous for being confusing, but stick with me, and by the end of this, you'll have a much clearer picture of what's really going on inside the body.
So let me just ask you this. What happens when your body's own defense system turns on you? I mean, think about it. The very system designed to protect you from germs and viruses suddenly gets its wires crossed and starts attacking your own healthy cells. It's like friendly fire, but it's happening inside your own body. And that one idea right there is the key to understanding everything about this disease.
Okay, so here's the textbook definition. Lupus is a chronic autoimmune disease, but the word you really got to focus on is systemic. Why? Because this isn't an attack on just one spot. Nope. It can go after your skin, your joints, your brain, your kidneys, you name it. And that total unpredictability is exactly what makes lupus so tough to pin down and manage.
All right, so let's get into the nitty-gritty. What is lupus, really? What does this friendly fire actually look like on the inside?
Okay, here's the deal. Your immune system is supposed to be smart, right? It's supposed to know the difference between a bad guy, like a virus, and your own healthy cells. But in lupus, that whole recognition system just breaks down. It's what scientists call a loss of immunological tolerance. Basically, the body starts making these things called autoantibodies, which are like misguided missiles that target its own tissues. And that kicks off this vicious cycle of inflammation and damage that just keeps going. So, the big question is, why? Why does the immune system go haywire like this? Well, it's not like there's one single switch that gets flipped. It's way more complicated than that. It's actually more like a complex puzzle, or maybe a perfect storm of different factors all coming together at once.
Yeah, there is no single cause of lupus. It's just not that simple. The best way to think about it is that it's this incredibly complex mix of things. It's like your genetic blueprint sets the stage, and then something from the outside world comes along and pulls the trigger.
So we can pretty much group these factors into three big buckets. First up, genetics. We know this because if one identical twin has lupus, the other has up to a 50% chance of getting it too. That's huge. Second, you've got hormones. Estrogen in particular seems to play a really big role, which helps explain some other things we'll see in a minute. And third, there are environmental triggers. This is the spark that can light the fuse, so to speak. We're talking about things like sunlight, UV light, certain viruses, some medications, and even smoking. So you see, it's not just one thing. It's this combination of your genes, your hormones, and your environment all colliding.
Now, because it's caused by this mix and match of factors, it probably won't surprise you that lupus looks different in almost every single person who has it. It is absolutely a disease of many faces, and that's exactly why it's earned a very specific nickname.
And when you look at who gets lupus, one thing just jumps right out at you. It is overwhelmingly a disease that affects women. We're talking a 9-to-1 ratio compared to men, and it most often strikes during their childbearing years. This huge gender gap is one of our biggest clues that hormones are a major piece of this puzzle.
And this right here is what makes diagnosing it such a nightmare. There's a reason doctors call lupus the great imitator. It's because its symptoms can look like, well, almost anything else. They're so all over the place that they can mimic dozens of other illnesses. I'm talking rheumatoid arthritis, fibromyalgia, chronic fatigue, you name it. Let's take a look at just how wild this range of symptoms can be.
So if you're a doctor, what clues are you looking for? Well, first, there are the really common ones that hit more than 90% of patients. Things like crushing fatigue, a persistent low-grade fever, and losing weight without trying. Then you start to see the more classic visible signs. The most famous one is that butterfly rash that spreads across the cheeks and nose. But you also see things like extreme sensitivity to the sun, or even painless sores inside the mouth or nose.
And the great imitation doesn't stop there. It moves into the joints and the blood. A huge number of patients, we're talking 80 to 90%, get arthritis that can look just like rheumatoid arthritis. And when you look at their blood work, things get even more confusing. You might see a low white blood cell count, which makes you think infection, or you might see low red blood cells and platelets. It's just all over the map.
But this is where things can get really serious, even life-threatening, because that friendly fire can start targeting major organs. If it goes after the kidneys, that's called lupus nephritis, and it can lead to kidney failure. If it hits the brain and nervous system, it can cause anything from severe headaches and seizures to what patients call brain fog. It can even attack the lining of the heart and lungs, causing intense pain with every breath. Okay, so with all these overlapping symptoms that look like a dozen other things, how on earth does a doctor figure out that it's actually lupus? Well, there's no single aha test. It's really more like a masterclass in clinical detective work.
The process is super methodical, and it happens in stages. Step 1 is just listening. A doctor has to take a really thorough patient history and do a physical exam. Step 2, you move on to the lab work. Blood tests, urine tests, the whole shebang. And finally, step 3 is where they put all the pieces together. They use a special point system, a set of classification criteria that's basically a checklist to see if all the clues add up to a lupus diagnosis.
And for almost every patient, that investigation kicks off with one very important blood test, the anti-nuclear antibody test, or ANA for short. Now, this test is incredibly sensitive. Over 97% of people with lupus will have a positive ANA. That's so high that if your ANA test is negative, you can pretty much rule lupus out. But, and this is a huge but,
A positive test does not mean you have lupus. Not at all. See, while the ANA test is sensitive, it's not very specific. Plenty of perfectly healthy people can have a positive ANA. So can people with other autoimmune diseases. So really, a positive ANA is just the first breadcrumb on the trail. It tells the doctor, okay, we need to investigate this further.
and that's when they bring in the specialist detectives, these more specific antibody tests. These are the real clues that can crack the case. For example, antibodies like anti-dsDNA and anti-Smith are super specific to lupus. If those show up, a doctor can be much more confident in the diagnosis. Other antibodies can even point towards specific types of symptoms or risks a patient might face.
So, once the diagnosis is finally confirmed, the whole game changes. The focus shifts from what is this to how do we manage this? Because right now, there's no cure for lupus. So treatment is all about a long-term strategy to keep the disease in check and protect a person's quality of life.
And the goals here are layered, you know? It's not just about making the symptoms go away today. The real goals are much bigger. You want to prevent those flare-ups from happening in the first place. You absolutely have to protect the organs from damage. The ultimate dream is to get the disease into long-term remission. And you have to do all of this while trying to keep the side effects from the medications to a minimum. It's a real balancing act.
The way doctors approach treatment often looks like fighting a wildfire. There are two main phases. First, when the disease is actively flaring up and causing real damage, that's induction therapy. Think of this as the all-out assault, using the big guns like high-dose steroids to put out the fire. Then, once things are under control, you shift to maintenance therapy. This is a less intense, long-term approach designed to keep the embers from flaring up again.
And then, no matter what's going on with the disease, there are some basics that apply to pretty much every single person with lupus. There's a drug called hydroxychloroquine, which is a real cornerstone of treatment for almost everyone. Sun protection is not a suggestion. It is absolutely essential. Simple lifestyle things like managing stress and not smoking are huge. And maybe the most important thing of all, it takes a team, a rheumatologist, a kidney doctor, a skin doctor. They all have to work together. Which brings us to one last, and maybe most important point. Lupus is often called an invisible illness, and that's because some of its most devastating symptoms, the bone-crushing fatigue, the constant pain, the brain fog, you can't see them on the outside. And so it leaves us with a really important question, one that goes way beyond the clinic. How can we, as a society, get better at supporting people who are fighting these incredible, exhausting battles that we can't even see?